not have everything we want in it, but I think it sets the groundwork or a basis, for getting to those other things.
Well, I know Senator Begich got a lot put in this bill. In fact, Senator Harkin from the floor commented on how much amazing work a freshman senator in Begich had done, and went on for like 4 or 5 minutes and used his time to say how hard Senator Begich had worked. Senator Begich wasn't out there going, I'm not going to vote for it if you're going to have this in it or that in it, and playing hard to get like Ben Nelson or that absolute horrible Joe Lieberman. But, and I was really proud of the fact that he was able to okay, we're not going to get everything we want, so I'm going to work with Bernie Sanders to get, an extra $10 billion for what is it?
Community health centers.
Community health centers,
great.
rural health centers. I know that we had smaller hospitals in Alaska that were included in getting funds, more physicians' assistants being funded, and working really hard on this. And I agree with you. The President Obama, for just a guy from Kenya, has done a hell of a job. And my guess is this, when it comes back and it's time for the next election, if this passes and this is instated and people can start rallying around what they got instead of what they lost, the biggest thing that he'll have lost so far is the Olympics, and frankly, whatever, that's okay. Well, we got to run to a break, but we're coming back with lots of fun questions. Yes, and I've got my lifelines here. I'm Shannyn Moore, this is More Up North, and we'll be right back. So much for clapping like you mean it. If you want to come and join us for a live audience, please go to moreupnorth@gmail.com. Send us an email. We'll get you tickets, and you can come down here to Bernie's Bungalow and have an adult beverage and get to turn in your questions for the panel, like all these fine folks have. So here we go. My lifelines. Vince Beltrami, you better be good. All right.
Do we have a limit on the number of words for the article?
Yes, you got to do it quick.
Oh, yeah.
Shannyn, so why didn't you have an insurance person on the panel? Because they're all celebrating right now and too drunk because they're so happy about all the sick people they're getting. There you have it. Next, my Medicare health insurance will make me taxed at a higher rate with no guarantee on premiums coming down under this bill. Why on earth should I support this? Any ideas? Can you be the lifeline, please, doctor?
As the pediatrician speaking on senior health care? Absolutely.
Yes.
You know what? The seniors in our state will be benefited by the donut hole in Plan B being minimized, and so you'll get more coverage of pharmaceuticals. And right now, there are terrible situations where families are having to choose between buying groceries and their medications, and so that's a huge step forward.
So we've got that going. Okay, so it's baby steps for old people. I want health care reform, not health insurance reform. I have health insurance. Why should I care? Bitter. No.
I know.
Okay, Hollis French. Senator French.
The price of your health insurance is going to go down with the passage of this bill because every year, every person in Alaska pays between $1,500 and $1,900 to cover the cost of those who are not insured today. And once those insured people get in the pool, the price of insurance should go down.
And then the immediate benefit of having pre-existing conditions no longer be something that makes you uninsurable.
Right, there is that. That's a good thing. Okay, and like I said at the beginning, maybe it's not a personal victory for you, but how can you take it away from 30 million people that right now need it? I mean, that's kind of the place that I've come to, that it's not a personal victory for me. It's certainly not a public option, but it actually gives options to 10% of the country, and I'm not going to take that away and say, no, I don't have mine. For Shannyn and panel. Shannyn, you found out today that Sarah Palin had preemptively banned you from her book signing. If you were having a book signing for Going Rouge, would you have a banned person's list, and if so, who would be on it? No. I did find out that Sarah Palin didn't want me at her book signing today, and that's kind of ironic because I didn't really want to be at her book signing today, and I wasn't there. But she had a picture apparently, and my name on the list. I wouldn't walk across the street to talk to her, but she's welcome to come on this show anytime. Let's see. Is the doctor single?
The doctor is married and happily married.
Put that ring up. It's shiny. Hello.
Hey,
That's working.
and she's married to a union guy. She's got a good union health plan.
She's a doctor with insurance for
although
the union.
maybe we ought to talk. I might have a better plan than he does.
I doubt it. I apologize.
So I guess that pretty much answers, can I get the doctor's phone number? What is this?
It's the dating game.
It's the dateless and desperate.
I just want to try the doctor's stethoscope on.
Oh, absolutely.
More loving up north. That's the next one. We'll do that for the Valentine's Day show, okay? Oh, wouldn't that be fun?
I don't want to put
Why has the value of all major health insurance companies gone up almost 30% since early October? Oh, all their stocks, because they think there might be a chance that they're going to have all these additional people, which it seems. Who are the people who will not be covered under the reform? We keep hearing it will cover 95% of the population. Who are the other 5%?
Sarah Palin.
Shannyn Moore.
Shannyn.
Yeah, apparently the 5% are the unemployed bloggers from Alaska, including Sarah Palin. Hollis, also known as Senator French, running for governor. How will the proposed reform of health care impact the Medicare situation in Alaska? Too few primary care docs available to afford to treat Medicare patients.
Two ways. One, Congress has promised to continue to work on this problem in 2010 to work on the low reimbursement rates that Medicare doctors are currently getting, and that is a federal problem, but there are things the state can do, and that's in the way of constructing a Medicare clinic where you get better reimbursement rates. I've been talking for some time to the folks at Providence and also to the folks at the Neighborhood Health Center about their plans to build a Medicare clinic where doctors can work out of this clinic, see Medicare patients, and get better reimbursement rates.
Do you want to answer to that too?
I'd love to add to it. You know, there's definitely a benefit to having the same doctor, having a doctor that knows you, and having a doctor that you trust. And so a primary care physician is an incredible role to try and decrease the spending that we do in healthcare. Because if I tell you it's just a cold and you know me and you trust me, then chances are you won't go to the ER for some antibiotics you don't need. If I know that you're going to be compliant and go to the chiropractor or do acupuncture for some back pain, I may be able to prevent a back surgery that has a 50% chance of succeeding 10 years from now. And so by building these relationships, you actually decrease costs. And so focusing on reimbursement for primary care doctors is really important, because right now we have a system that reimburses procedures and reimburses sickness rather than reimbursing wellness. And so changing our fundamental focus as a country is going to be really important. And that's what really changes the trajectory, because if we can make a healthier society, then we're going to spend less later on.
Right.
And be healthier.
Absolutely. To Shannyn and the panel, in response to the question asking what letter grade he would give himself on health care reform, President Obama gave himself a B+. Correction, I think that was actually his first year that he was grading. That load of steaming crap aside, what grade would you give him, and how would you evaluate his performance? Oh, this is an interesting question. For sure, like I said, for a guy from
On
Kenya.
healthcare or on the
healthcare?
whole?
On healthcare, well, they wrote it on healthcare. That's not what he graded himself. What would you grade him?
I give him a B.
A B?
Yep.
A++ minus the gay agenda, the homosexual agenda.
For Don't Ask, Don't Tell still being it.
Exactly.
I know. 2 straight women, and we're like pissed off about Don't Ask, Don't Tell. Go figure.
Well, I think everyone should be able to marry whoever they love.
I think this, I don't think anybody should be able to get married until divorce is illegal. That's right. That's right. The war on marriage is divorce. It's not gay people getting married. Vince?
Well, given what he's been fighting and how difficult, a hurdle he's had to overcome and total obstructionism on anything he's tried to do, I think he's done great, and I'd give him an A.
All right.
But I like the guy. I read the book, shook his hand.
A couple of times you shook his hand. How would I grade the president? I'd give him an A for effort. I certainly would. I think that he has good intentions, but I bet he got in there and just went, what in the hell was I fighting to get elected for? Hillary, I know it's 3 o'clock. You want this job? Because I can't imagine. And to have all these people, you lie, and this sort of, thing that we haven't had other presidents have to deal with, short of assassination, the sort of disrespect he's got. And so, you know what? I would give the American people, though, less of a grade, because I think so many of us were like, hey, we voted for change. Now I'm going to go sit on my ass and like not do anything and hope he figures it out. Go Obama. And it's like, really? What have you been doing? What have you been doing to help create the change? So I think I'd grade him better than I have the American people.
And if all those people sit on their asses in the midterm elections, I'm going to be pissed at them too.
Really?
Because it's all about, I mean, this is a process, and they need to, they
Right.
can't just show up every 4 years and check a box. They've got to be involved in the process,
Right.
and if they want to see the change they voted for, they got to be a part of it.
That's right. Democracy is a verb. It certainly is. I want to thank everyone, all of you, for being here. It's been awesome. Thank you to my panel. And if you want to come down and be part of our audience, we're filming next year. That's right. Happy New Year, Merry Christmas, all of that. This is Shannyn Moore. Thanks.